Hi, good morning. This is Dr. Yun Han Kim. I'm functional Nomad MD. And today I just want to talk about something that is on probably a lot of people's mind. It's hypothyroidism made simple. So, hypothyroidism is very common in our society. And I think it's a very complex condition. Yet, if you know how to approach it, it's not that difficult. So, hypothyroidism just means that your thyroid is not working optimally, and there are many symptoms of hypothyroidism, including being cold all the time, constipation, dry skin, and whatnot. And there are a lot more interactions with body that thyroid hormone has. So the first question is why. So if the why is because post-surgical removal of hypothyroid gland, then you will have hypothyroidism secondary to the surgery. So that's one way you can get to hypothyroidism. Those people are usually very easy to manage. You just check their lab, um, TSH, free T3, free T4, as as rare, I mean, as long as maybe even 1 year at a time. And I just educate them that hypothyroidism symptoms, hyperthyroid symptoms, if they, especially if they get palpitations, that means that they probably developed hyperthyroidism secondary to the medication, which is a thing. So that's the easy part. And then if you don't know why you have hypothyroidism, the easiest thing to do would be obtain a full thyroid panel. I know that conventional medicine, um, unlike functional medicine, likes just TSH to screen, and that may be appropriate in population setting. But in my population setting, usually people come in with more complex conditions, or they are not responding to the conventional approach. So then we have to do a little deeper dive, and the little deeper dive in this case would be obtain full information. So what do I mean by that? Yes, I still get the TSH, and then there's T3 free, T4 free, and then there's reverse T3 and two antibodies, TPO antibody and thyroglobulin antibody. So you get a full spectrum picture, and then you ask yourself, is TSH showing hypothyroidism? And then if it is, then you ask the second question, which is, what are the respective values of T3 free and T4 free? If those are normal, and what I will do is look now, you can look at the antibodies. If you look at the antibodies and they're elevated, the chances are they have an autoimmune contribution to hypothyroidism, loosely called Hashimoto's thyroiditis. And Hashimoto's thyroiditis is autoimmune contribution to hypothyroidism. So, and that's actually something that can be treated, can be even reversed at times. I'm not saying that every hypothyroidism that is Hashimoto's thyroiditis can be reversed. I'm not saying that at all. And it's also true that once you need thyroid hormone, such as needing the having the thyroid gland removed, you need supplementation. It That's kind of what I've learned, that when you're a type 1 diabetic, you need insulin. If you are if your thyroids have been removed by surgery, then you need thyroid hormones. If your adrenal glands are no longer producing cortisol, then you need appropriate hormones to replace that. And not, I think that I meet so many people that think that they can just wing it, and just do things naturally and not check labs. And in one of the health systems, I learned that if you don't measure things, you can't improve them. And that's really made a big impact. And I wish they taught me in medical school, but the impact was made through a health system. And I think that's really true, that if you don't measure everything, if you don't know everything, you don't know everything. And then you get to make decisions based on half-assed decisions or knowledge that's not complete, and then it's easy to make mistake. Now, for the majority of people, in conventional medicine, this is not a problem. But if you are experiencing some difficulty with diagnosed with hypothyroidism that is not post-surgical, then I think that a conversation between you and your physician to beg them to consider checking everything is in order. So, and that's what we functional medicine physicians do, is that we try to look at the whole picture, look at the root causes, and not each and every time we can find the root cause. But when we can find the root cause, then we have an opportunity to deal with it. What does that mean? Well, if you had surgery, root cause is that you don't have a thyroid gland, so you don't make a thyroid hormone. So you just replace it, and that should be pretty simple. If your hypothyroidism is coming from autoimmune, then it gets a bit more complex, because depending on what stage of autoimmune condition you have, there may be an opportunity to reverse that. And reversing is not a guarantee, it's not 100%, but I've seen it in enough patients that I think that what it can do is optimize the clinical outcome, or reduce the amount of medication that is needed. And sometimes that people just feel better. And that's a good outcome too. And I think that in conventional medicine, we overlook that part of, we're supposed to help people to feel good, and live their lives with minimum amount of morbidity or complications. So this is Dr. Yunhan Kim. I'm on Nomad, functional Nomad MD. And if you have any questions, just let me know, and I'll try to answer them either in the chat box, or reply or incorporate it into my next talk. Thank you.